I will now hand over to our next speaker, Sue Tape, who will present on advocating for children and young people with disability and their families during the COVID-19 pandemic. Thanks so much, Sue.
Thank you, Grace, and thank you, Katrina, for outlining that important piece of work. So to introduce myself, my name is Sue Tape. I work for CIDA, or Children and Young People with Disability Australia, in a project coordinator role, and my pronouns are she, her. So CIDA is the national representative organisation for children and young people with disability aged 0 to 25, and our purpose is to ensure that governments, communities and families are empowering children and young people with disability to fully exercise their rights and aspirations. If I could get you to go to the next slide for me, please. We would like to acknowledge the traditional custodians of the land on which we work, live and play, and we pay our deep respects to elders past, present and emerging, and acknowledge that sovereignty was never ceded. If I could get you to go to the next slide, please. So I wanted to take the first minute to say thank you. Thank you to individual carers who have completed CIDA surveys or provided information and stories for submissions. I would like to thank organisations across New South Wales and also across Australia who have assisted us with sharing our requests for feedback over this time, and also to thank carers and support workers who have worked with people with disability to tell their stories as well during this very important time. So what I've tried to represent on this slide is how I've felt about 2021 and the things that we've been hearing from people. So lots of different things on the slide, ranging from the good, the bad and the ugly. So we've got job changes, isolation, learning from home, vaccination, nasal swabs, streaming services. Isolation is actually there twice, my son pointed out to me. Exercise, friends and family, social distancing, time with pets, financial pressure, lockdowns, quarantine, and most importantly, home haircuts being under the category for ugly things that we've all experienced, or lack of haircuts during this time. And I say this with a smile on my face because we have heard from people, many people with disability, young people with disability, that COVID-19 has been very difficult and has highlighted many of the existing inequities that children and young people with disability and their families face, but has also provided them with opportunities that many wouldn't have had presented to them if they had been learning in person at school, or if they had been trying to look for certain types of work. So there have been silver linings in some clouds. There have been opportunities presented. And people have worked very hard to try and find the good things out of what has been a difficult situation. If I can get you to go to the next slide for me, please. So what I wanted to represent here was what we've been up to. So what has CIDA been up to in this space? And it really builds on some of the things that Katrina said around the work that they've done, which is understanding what has been going on for people. I know that everyone is facing a little bit of survey fatigue, but to be honest, it's one of the most accessible ways for us to get information from people who would like to share their story anonymously, or aren't necessarily in a position to advocate for themselves direct to the source of the problem. So it has been a magnificent opportunity to actually engage with people. And what you see on this slide down the left-hand side is the types of work that we've been up to in the last 12 months. So we presented at this conference last year, and very grateful for the opportunity to be part of this again. What we've been trying to do is build on our work and advocating during COVID. So the circle that you see there with children and young people with disability at the centre, that's showing the sorts of areas and topics that we've been advocating on. So things like education and health, support services, finance, housing and transport, and around community and culture. So looking at children and young people with disability as a whole person. One of the challenges that we've faced in advocating has been that obviously there are lots of different people involved in these areas, lots of different departments, etc. And trying to present a picture to explain to people who are deciding policy and programs that shows them that the decisions they make impact a person, impact their family, impact their situation, and where those decisions may not be guided by direct input from people with disability or may not be considered of people with disability, there can be a trade-off. There can be there'll be times when families, for example, have been forced to choose between the risk to a child's health and a risk with the loss of education. So, should my child really go to school during lockdown? Is that the best decision for them from a health point of view or from an education point of view? And that's because sometimes they haven't received appropriate adjustments for learning from home. And for them to continue with their education, the only option has been to go to school. And those sorts of decisions are extremely difficult. And require trading off one between the other. And so it's been really important for us to make sure that we are helping policy and program designers and decision makers to understand the impact on the whole person. And that's been a really important and challenging part of our work. So the other thing that you'll see on this slide are the areas of focus that we've been working on. So as I've already mentioned, the impact on people's education and learning from home and what children and young people with disability need to be successful. We have been advocating most recently around access to testing, PPE, and in the last week or so, vaccination. The whole time during COVID, the Disability Royal Commission has continued. And also Katrina talked about the NDIS, and we've obviously been working hard in that space around making sure that suitable information for participants has been getting out there. A lot of the information is often written first for providers, and then participants are then communicated with after that, and we've been providing the NDIA with feedback on that. Independent assessments were a key feature of some of the advocacy we've been doing earlier this year, and we continue to work on transitions for young people from school to employment. As many carers will know, some of the COVID assistant payments didn't necessarily support carers, nor were they considered for those under the disability support pension. So that's also been a key part of our work. And then at the same time, we've also been looking at how school transport needs to change. And the National Disability Strategy, the new one, has been bubbling away in the background during this COVID pandemic. So lots of things going on for CIDA and hopefully trying to further the situation faced by children and young people with disability and their families. If I could get you to go to the next slide, please. So the three most visible our work in the last 12 to 18 months have been these three reports, and all done in collaboration with university researchers and academics. So I introduced the first two last year during this same conference. So this was our report around the experiences of students with disability during COVID, and then also holistically the more detailed report around the experiences of children and young people and their families. So this went across health, education, finances, etc. And then our most recent, which was released last week, was the report on our survey work around vaccination discrimination. So this has been the challenging experience for 12 to 25-year-olds to access a COVID vaccination. And we had a terrific response from young people and also the families of children with disability to share the challenges that they faced in obtaining a COVID vaccination and accessing appropriate supports to get a vaccination underway and have a good experience in getting that vaccination as well. So not just about getting it, considering that the first time needs to be successful and proactive so that you can go back and get your second one. So making sure that both those experiences have been positive ones for children and young people with disability. So if I get you to go to the next slide, please. So this is my last slide. And one of the things I wanted to flag was that CIDA will be continuing to work to advocate on behalf of children and young people with disability and their families. So obviously that covers many people and organisations involved in this conference today. And thank you again to Carers New South Wales for having us involved. Our education surveys, which are an annual survey, will continue again this year. And we will be following up on some of the questions from last year around the experience during COVID, conscious that particularly for New South Wales and Victoria, we will be interested in how learning from home has been for students during lockdown in those states and territories, and ACT, sorry, not to forget ACT. So again, I would encourage people to check out the CIDA website. The 3 reports that I mentioned on the previous slide are there. They are ongoing and key pieces of information in our work. And a lot of that work is behind the scenes, putting information to policy and decision makers to understand the impact of the decisions that they make, and making sure that where possible, communication with children and young people with disability and their families is timely, accessible, and proactive as well. And I just, again, wanted to acknowledge the hard work done by individual carers and organisations in supporting us to bring those stories to the decision makers, but also thank you for the support that you provide for children and young people with disability. So I would ask that many of you in lockdown situation take care of yourselves, and to make sure that you access support and help where appropriate, some of which obviously is available through Carers New South Wales. But if you are looking for specific information, please access our website, which is noted on the slide there, or just cida.org.au. And I would welcome any questions, but thank you very much for having us as a part of this conference.
Wonderful. Thank you so much, Sue. A fantastic presentation. I can just see that we're waiting on some questions to come through. So please, if you do have any questions for Sue, feel free to leave them in the live Q&A and I can star them for her to answer. But I suppose in the meantime, and I hope I'm not putting you on the spot, the most recent report that you've done on vaccination discrimination, would you be happy to expand on any of the key findings or anything that you thought was particularly insightful or that we should really know about?
I think many people might have seen the publicity about the draft Disability Royal Commission report that also came out at the same time. And the themes are similar in that young people with disability aged 16 and over were always in the priority list originally around the rollout. Unfortunately, that hasn't panned out for many people who've been in Category 1B in a proactive way, in a timely way, in a proactive way. So that's similar to what Katrina was talking about. Those sorts of inactions or those sorts of challenges create undue stress in both children and families. And I think what the report also clarifies is that this isn't just as simple as having a ramp at a vaccination centre. This is about communication. This is about also even the sensory approach to getting a vaccination. Things like being able to jump the queue. So where a young person is not in a position physically, emotionally, socially to stand in a line for long periods of time. Families have talked to us about the multiple challenges in dealing with the booking system, whether it be on the phone, on the computer, or even just in person and filling in forms, etc. So unfortunately, those things that we had highlighted were going to be challenges when we were first consulted around the needs of young people with disability have not been dealt with. And there are some states and territories who have done some things to be proactive in this space. Unfortunately, it's not consistent across geographical representation. So the experience that you have in a metro health setting might be quite positive, but that's not consistently felt across all cohorts and in all places. And that's disappointing in that most people, young people with disability, would have been on the priority list from say April at this year, and we're now in early October, and we're still not getting it right consistently. So it's been quite disappointing, and that's the stories that have come through. I think what is clear in the report also is the impact of those experiences when families have had multiple challenges and faced multiple inequities across the system. So.
Absolutely. And I know that we have just a couple of minutes left as well, but I suppose a follow-up question to that would be, knowing the barriers and the challenges that exist, how would you recommend, I know it's a huge kind of blue sky thinking question, but how would you recommend kind of bridging those gaps and encouraging access to vaccines?
For young people with disability, I think it's I would ask policy and decision makers to be more proactive in approaching organisations that have links into young people with disability. So, whether it even be things like sporting clubs or community centres or, pool-based activities, etc. So find where the networks are to help people to access vaccinations in environments that they find comfortable, that they're used to, that their families know are accessible. Just knowing things like, okay, I'm going to go down to the local pool to get the vaccination. I know where the toilets are. I know where the car park is. My young person knows what that place is like. We know we can get a takeaway, milkshake after we've done this, and we can have that conversation about what this feels like. So I think it's finding the places where people are and being proactive and getting out there and using really straightforward communication. And I seeing the communities that are being proactive themselves and the community groups that are sort of doing pop-up clinics in the most interesting of places. I listened to a radio report about a South Sea Islander community group who had set up exactly like their village, and they were just getting the numbers down and young people getting vaccinated. And it was just brilliant to hear the enthusiastic voices of what those young people were doing to protect their community. So things like that, where it's meeting people where they go comfortably.
Absolutely. Fabulous. Thank you so much again, Sue, for your presentation, for answering those questions.